Nuevamente, bienvenidos a todos
Once
a
again,
este webinario.
welcome to this
Gracias
webinar.
por estar aquí hoy. Mi
And
nombre es
I
Eric
want to
Senior.
thank you for
Soy el
being here
asistente
today. My
técnico
name is
para
Eric
el
Sr.,
Centro
and I
de
am the
Excelencia
technical assistant
Latino
for the
Hispano.
Hispanic
Y
Latino
se une a
Behavioral Health
nosotros
Center
nuestra
of
invitada, la
Excellence.
doctora Marianela
And we
Rodríguez
will have
Reinaldo.
our guest,
Estamos muy
Marianela
afortunados
Rodriguez
de poder
Reinaldo.
trabajar de este
I
tema
am
que muchas
very
veces se pasa
fortunate
por
to
alto
work in
y
this
que es
topic
tan importante para
today
las
that
comunidades
sometimes
latinas.
we don't pay attention to, and it's so
Así que
important for the
queremos que
Latino
todo el
communities.
mundo sepa que para
We would
escuchar esta
like
presentación en
everybody to
español
know that in
pueden ir
order
a
to
la
hear
pestaña de
this
interpretación en el panel de
presentation in
Zoom y
Spanish,
escoger
you can
español.
click the interpretation
Antes de
tab
que
and then
comencemos
click on
hoy, quiero
Spanish.
decir algunas cosas
Before we begin
administrativas.
today, I
Este evento
want
se
to
está
do some
grabando y
housekeeping.
estará
We will
disponible al
be
público en nuestra
recording
página
today's event
de
and
internet y en
it's
nuestros canales.
available to all the public
Para todos los participantes
on our
hoy van a tener sus
webpage
micrófonos
and
apagados.
others.
Por favor,
Please
asegúrense de que
keep
tienen las
your
bocinas
mics
de sus
off and
computadoras
your
prendidas
cameras
para que
off
puedan
and
escuchar.
turn your
Si
speakers
tienen
on so you
algún
can
problema
hear today's
técnico, por favor
presentation.
envíen un
If
mensaje
you
a
are
Hispanic
having
and Latino
technical
Behavioral
issues, please
Health
send a
Center
message to the Hispanic and
en la caja de
Latina
chat.
Behavioral Health
Si tienen alguna
Center of
pregunta
Excellence on
para
the
nuestros
chat box.
presentadores,
If
le
you have a
pedimos
question for our
entonces
presenters,
usen la
we ask
pestaña de
you to
Q&A para
use the
preguntas y
Q&A
respuestas.
tab on the
Eh,
toolbar.
Escriban su pregunta ahí
Type your
y la
questions
envían. Por
and
favor, usen esa
hit
misma
send.
pestaña para cualquier
We can
pregunta que tengan
address
para
questions to
la
the
presentadora.
presenter at
De
the
esa manera
appropriate
podemos
time during
entonces
today's
dar tiempo
presentation
de
or
preguntas
at
a
the
nuestra presentadora en el
conclusion.
momento apropiado.
And
Vamos a tener una
we will
sesión de
have
preguntas y
a
respuestas al final
presentation
de la
of
presentación.
at the end
Vamos a
of the
estar enviando
presentation,
una copia de la
and we will be
presentación de hoy en
sending
formato
today's
PDF más
presentation in
adelante.
PDF later on.
Por favor, recuerden que una vez que
Please
completemos el
remember
episodio, que
that
completen la
once we
evaluación,
complete the webinar,
se les va a compartir el
complete
enlace a esta
the
evaluación y
evaluation,
también
and we
pueden
will
escanear el
share an
código QR.
evaluation
Es
link
muy
through the
importante para
chat.
nosotros
And
saber
also,
su
you can
opinión sobre esta
scan the
presentación
QR
y
code.
también saber más
It is
sobre
very important
temas y
to us to
entrenamientos que les
learn more
gustaría que nuestro
about
centro
this
ofreciera en el
presentation
futuro.
and about your feedback
También
regarding
quiero
webinars in the
decirles que se
future.
les va a enviar un
Escuchan.
certificado
We will be
de haber estado en
sending
este
a
webinario.
certificate of
Un
attendance
poco
for
sobre
this
nuestro
webinar.
centro,
To talk to you
aquí en el
about
Hispanic Latino
our
Behavioral
mission,
Center
it is to
Excellence es
advance
fomentar y
and
apoyar la
support the
sostenibilidad y la equidad en
sustainability
salud
of
conductual,
behavioral health
promoviendo
equity
la
by
prevención impulsada
promoting
por la comunidad
community
basada en la
driven,
cultura, centrada
culturally
en la persona,
grounded, and
en la
person
intervención en
centered prevention,
múltiples vías de recuperación
intervention,
y en apoyo
multiple
a la
pathways
recuperación
of
para diversas
recovery, and
comunidades
recovery
hispanas y
supports for
latinas.
diverse Hispanic and Latina
El,
communities.
el Hispanic Latino
The
Behavioral Health
Hispanic
Center of
Latino
Excellence
Behavioral
reconoce
Center
las
of
complejidades
Excellence
asociadas a la
recognizes the
identificación étnica
complexities
y de género,
associated with
así como el
gender and
derecho de todas las
ethnic
personas a
identification,
autoidentificarse.
as well
El
as the
centro
right of
utiliza el
all
término latino con la
individuals to
intención
self
tanto de facilitar
identify.
una lectura y
The
pronunciación
center
fluidas
uses the term
como de
Latina with
apoyar
the
un lenguaje inclusivo y
intention of
respetuoso.
both
Latina
facilitating
es
a
una forma de
fluent
género
reading
neutro
and
de la palabra
pronunciation,
latino
supporting an
que
inclusive
utiliza
and
la letra E
respectful
al final,
language.
una idea
Latina
originaria
is a
de la
gender
lengua
neutral form of
española.
the word Latino that uses the
Y
letter E
quiero
at
darle
the
la
end, an
bienvenida a la
idea native
presentadora
to
de hoy,
Spanish
la doctora
language.
Marianela Rodríguez
I would
Reinaldo.
like
Es
to
madre educadora de
welcome
lactancia certificada
Dr.
y
Maria
psicóloga
Elena
clínica
Rodriguez
certificada en salud
Reinaldo,
mental
who
perinatal.
is a clinic
Durante los últimos 15 años ha
psychologist
trabajado
in
exclusivamente en
prenatal
el
health.
campo de la salud
She
mental
has
perinatal.
worked in
Es coordinadora
perinatal
de
mental
voluntarios
health
en
for
la
the last
ISP,
15 years.
Relaciones Públicas y
He
formadora
is a
internacional de
PSI
organización.
volunteer coordinator
Trabaja
in
como
Puerto Rico
consultora
and
de
an
psicología para el
international
Departamento de
trainer with
Salud
the
de Puerto Rico,
organization. She
sección
works
Madres,
as a
Niños y
psychology
Adolescentes del Privado
consultant for the
5,
Puerto Rico
donde
Health
también
Department, Mother,
es
Child,
miembro
and Adolescent
de
Section,
la
Title
Junta de
5,
Revisión de
where she's
Mortalidad Fetal
also a
Infantil,
member of the Fetal and Infant
FIMR en
Mortality
inglés.
Review Board,
También ofrece
FIMR.
psicoterapia de apoyo
She
en el
also
Centro de
offers
Estudios
supportive psychotherapy for
Materno-Infantiles. Así que bienvenida,
PLWHIV
los
at the
dejo con
Center for
la
Maternal
doctora
Infant
Marianela
Centers.
Rodríguez.
And now
Gracias a
I leave you
todos.
with Dr. Marianela
Gracias,
Rodriguez.
Eric. ¿Me pueden escuchar?
Thanks, Eric.
Sí.
Can you hear me?
No tengo ningún
Fine.
conflicto de interés financiero
I
o
do not
financiero
have
para que se comparta
any
esta presentación.
any
Le quiero agradecer por
financial
haberme
conflict of
invitado
interest for this presentation.
específicamente por
I would
haber
like to thank
escogido
you
este
for
tema y reconocer la
inviting me
importancia
and
de la salud
acknowledging the
mental perinatal. Estoy
significance
muy
of
feliz de poder
perinatal
hablar de
mental
esto.
health. I am very pleased
Así
to
que
talk
en el
about this
webinario
topic
de
today.
hoy lo que quiero hacer
So, in
es
today's
introducir,
webinar, what I
presentar y
would like
definir
to
conceptos
do is
relacionados con
to
la salud mental
present
perinatal
concepts
y su
related to
impacto en
perinatal
nuestra comunidad
mental
latina
health
y hispana.
and its impact in our
Descubrir los
Latina
signos y síntomas de
community.
los trastornos
To
mentales
discuss the
comunes
signs
durante
and
este
symptoms
periodo
of
y
common mental
aumentar
health
la
disorders during
concienciación.
this period and
eh,
increase awareness
y dar
of
una
perimental health in the general
idea
public
más
and mental
amplia.
health
Podemos adentrarnos en
professionals.
esto, como van a ver, hoy no tenemos el
Also,
tiempo
I would
para
like to
eso, pero
provide resources for
definitivamente
clinicians
hay
and
mucho
other mental
más
health providers.
de lo que vamos a
I don't
descubrir.
have all the
Y
time in the world, but
finalmente quiero
definitely
proveer de
there's much more
recursos.
that we
Cuando
will
yo
discuss
empecé en
today.
este campo,
And later, I would like
había
to
muy
share some
pocos grupos de apoyo,
resources.
casi no
When I
había
started on
recursos,
this field, there
especialmente en
was very
español.
few support
Y
groups
ahora tenemos
and
una
very
certificación
few
que
or
estamos
no resources
proveyendo en
in Spanish.
español en
And
cuanto a
now
salud
we even
mental
have a
y grupos de
certification
apoyo
in Spanish.
virtuales,
We have
presenciales. Y
virtual
quiero
and
entonces
in
compartirles
presence
toda esta
support groups.
información para que
And
la
I will
puedan
be
tener.
sharing this
Me
information with you
parece que
so
en
that you
cuanto a
can have
los
it later
clientes
on.
que ustedes tienen,
Now, regarding
todos hemos nacido, así que todos
your
tenemos un historial de
clients,
haber nacido. Eso se
we
debe tomar
all
en cuenta.
were born. So
Eh,
this is something that we
y
share
la
as
mayoría de
part of our
nosotros también
history. So we
tenemos un
should take
historial
that into
reproductivo y un
account.
historial de
And
identidad de
most of
género.
us have
Y creo que este
a
tema es
reproductive
importante,
history and a gender history.
sin importar,
And
¿verdad?,
this
quién
is
ustedes ven o
very
a quién ustedes, con
important
quién ustedes trabajan. Así que
regardless
gracias
who
por
you
haber
work
estado,
with.
por estar
So
aquí.
thank you so much
Vamos
for
a
your
hablar
presence
de
today.
esto, de latine, latinex y
Now
qué significa.
let's talk about
Eh,
Latine and
Somos un
its
grupo
meaning.
muy variado, muy
We
diverso.
are a
Nos
very
podemos
diverse
ver
group, very
diferentes
varied.
dependiendo de
We
dónde
might look
somos
different
y
depending
dependiendo de
on
nuestros
where we're from
ancestros. Y puede que
and
hablemos
depending
hasta
on our
diferente.
ancestors.
Y
And we
realmente ese
might
término
even
latino,
speak
latina, latine,
differently with
latinex,
different accents. And this
usualmente
word
se utiliza en los
Latino,
Estados Unidos, pero
Latinx,
entre
Latina
nosotros,
is
nosotros
used
nos
in the
identificamos con
US.
nuestras
But
naciones, con nuestros
amongst
países,
ourselves, we
de dónde
identify
venimos.
each
Y
other
cuando
with
hablamos entre
our
nosotros,
countries,
preguntamos si
where
somos
we come from.
puertorriqueños, si somos
And when we
cubanos, si
talk
somos
to
de
each other, we
Colombia,
ask, are you
si somos de
Puerto Rican? Are
Venezuela,
you
y eso se utiliza
Colombian,
más que utilizar
Venezuelan?
los términos
And
latine o latinex
this is
o
used
hispano
more than just
o
using the terms
hispane. Así
Latine
que
or
habiendo dicho
Latina
eso y
or
entendiendo que
Hispanic.
no hay
And
un tamaño que
having
nos
said
sirva
that,
a todos,
and knowing
tenemos
that there's
similaridades y
not
quiero
one
hablar
size
de
that
estas
fits
cosas que
all,
tenemos en
we
común
have many
un poquito aquí
similarities.
en este
And I
tema
want
de
to
la salud
talk
mental.
about the things that we
Hablamos
do have in
español,
common.
eh,
All of us speak Spanish,
generalmente es nuestro lenguaje
and
que
this
preferimos
is
utilizar.
the language that
Le
we
damos mucha
prefer.
importancia a la familia y
And
a la
also,
religión.
we give a
Sí
lot of
tenemos
significance to
roles de
family
género
and religion.
tradicionales y
We
muchas
do
veces
have
incluso con las
traditional gender
generaciones más
roles,
jóvenes
and many
seguimos
times with the
eh,
younger generations,
implementando
we
estos roles que tenemos
continue
que estar conscientes de que
implementing these
existen.
gender roles,
Tenemos
and
un
we
protocolo en
must
cuanto a
be
las
aware of their existence.
relaciones sociales, en
Also,
cuanto
we
a
have a
respeto por nuestros
protocol in social
mayores y ese tipo de
relations.
cosas, y eso
For
también es
example,
importante
the
saberlo.
respect for
Y
our
también tenemos
elderly.
una
This is so important
naturaleza
in our
personal en
culture.
las relaciones.
And also,
Cuando
there's
nos
a
comparamos con
personal
los
nature
norteamericanos,
of
nosotros
relationships.
usualmente
When we compare
estamos más
ourselves
cercanos en
with
cuanto a lo que es
Americans,
espacio personal. Hablamos con
we
las
get
manos,
closer, we
probablemente nos
invade
podemos
the
tocar
personal
cuando
space,
hablamos
we talk
y
with our hands, we
necesitamos
might touch each other
esa
when we
naturaleza
talk,
personal en nuestras
and we
relaciones.
need
Y
that
creo que esto es muy
personal
importante que
touch
lo
in our
tengamos presente
relationships.
como
And I believe
consejeros y
that
como
it's very
terapistas,
important for us to have
porque
this in
también
mind
tenemos que
as
pensar lo que
clinicians
quiere decir
because we have to
el
think
hablar de nosotros mismos
about
cuando
what it
estamos
means
tratando
to
con
talk
latinos,
about ourselves.
cuándo ayuda,
And
cuándo no ayuda a
when
comportarnos
we're
así. Así
talking
que
with
esto es
other
algo que debemos
Latinos, we
mantener
need to know
presente
when to
también.
behave this way or not. So this is
Latines o
something that we
latinos
should
o
have in
latinx
presence.
es la
Latine
población de
and
mayor
Latinx
crecimiento en los
is the
Estados
biggest
Unidos.
growing population
Ahora
in the United
mismo
States
estamos en el
right now.
19.5% y
We
así
are
es como
in
se ve en el mapa
19.5%,
del
and this
censo
is
del
how the
2020,
census map of 2020 looks like,
en donde los colores más oscuros
where the
son
darker
donde
colors
está la mayor parte de la
are
población.
where the
Así que los
majority
exhorto aquí
of our
que
population is.
conozcan su comunidad, que
So I
conozcan
invite
su
you
estado.
to know your community, get to know your
En
state,
dónde están esas poblaciones mayores de
and
latines en
where
comunidades,
those
cómo se
bigger
ven,
Latina
de dónde
populations are
son,
concentrated.
por qué están ahí.
Where are they from?
Todos
Why are they
tenemos
there?
distintas razones para
We
estar en
all
los Estados
have
Unidos.
different
Somos
reasons
primera
to be in
generación,
the United
segunda
States.
generación,
We
cómo
might
se
be
ve, qué
first generation,
significa
second
eso.
generation. What
Y
does that
para
look like? What
entender
does it
eso es
mean? And in
importante
order to understand that,
trabajar
it's
con ellos.
important to understand that to be able to work with them.
Entonces, ¿por qué es importante la
Why
salud mental maternal?
is health,
Estamos
is
en
maternal
mayo,
mental health
que
important?
es el
Well,
mes de
we are in the
concienciación de la
month of
salud
May,
mental, y
which is the month of
específicamente
mental health
la salud
awareness,
mental perinatal.
specifically
El primer
perinatal
miércoles de
mental
mayo
health. The
usualmente se
first
conoce
Wednesday
alrededor
of
del
May is
mundo
usually known
como
around the world
día, el
as a
día
day
de concientización de la
of
salud perinatal.
awareness of perinatal
Este es el
mental
primer año en el
health.
que el Congreso
This is the
reconoció
first
la
year
primera
in which the
semana de mayo
Congress acknowledged or
como
recognized the first week
la
of May
semana
as
de la
the
concienciación
week
sobre la
of
salud mental
awareness
materna.
about mental,
Y de
perinatal,
hecho,
maternal mental health.
presentaron ya un
And they've
primer
already
plan
presented
de trabajo para
the first
trabajar con
work
la equidad en
plan
la
to
salud
work with
mental y
equity in
definen
mental health.
lo que es
And
salud
they
mental
define what
maternal.
is maternal mental health,
Presentan algunos
and as
términos
well as presenting some
que
terminologies
son más inclusivos que lo que es
that are
salud
more
maternal, que los vamos a
inclusive
ver.
than simply saying maternal, and we
Hablan de
will
parejas, de
hear about them. We hear about
no solamente las madres,
couples,
y por eso es que
parents, not
estamos
just
hablando de
mothers.
perinatal.
And so that's why we refer to it as
Van a
perinatal.
ver que hay una carga antes y después
There
de lo
is
que es el
a loaded, a
embarazo.
weight to,
Así que
there's a weight to
vea
prior and
el grupo
during
de
and after
trabajo y la información que ellos tienen y las
pregnancy.
estrategias que ellos
And
presentaron. Y nuevamente
you
necesitamos
can look
crear
at
más
what was
concienciación,
presented. And
creemos
again, we
concienciación
have
sobre
to
este tema
create
y
more
poner
awareness
mayor
about this
esfuerzo.
subject matter and make more
Hablemos
of
de
an
algunos
effort about
conceptos
this.
importantes
Let's talk about
en
some
este
important
tema.
concepts
Primero,
regarding this
hablamos de
subject.
antenatal o
When we
prenatal.
talk of
Estamos
antenatal or
hablando de
prenatal,
cualquier punto
we are referring
antes del
to
parto,
any point
usualmente el
before
embarazo.
the birth,
Pero
during the
cuando
pregnancy
hablamos de
particularly.
la salud
But
mental
when we talk
perinatal,
about
también
prenatal
hablamos
mental
del
health, we are
periodo de
also referring
concepción.
to
En
the
cualquier
period of
momento, desde
conception.
el punto en el que empezamos
At
a
any point from the
pensar en
moment we
tener
start
hijos,
thinking
formar una
about
familia,
wanting to have children, forming a
podemos
family,
tener algunos retos de fertilidad.
times during we
Desde el
might have some
momento cuando
challenges such as
empezamos a
fertility
pensar en
issues
eso,
from the very moment that we
eso
start
también
considering
está
this.
incluido en
So
ese
that is also
periodo
included in
prenatal.
that period of prenatal.
Ese tiempo del embarazo y todo
That
eso es importante.
period of pregnancy is
El
important.
periodo perinatal o periparto
The
quiere decir en o cerca
perinatal
del
or
parto, cerca del
prepartum
nacimiento.
period is
Muchas veces
before
se
birth, close
define
to the birth time, and
dependiendo de la
usually it's
literatura
defined, depending on the
desde 20
literature,
semanas de gestación hasta algunas semanas después
based
del
on
parto.
20 weeks
Ese es el periodo
after
de periparto.
gestation
Algunas veces
up to immediately
es
after.
días
That
después
is the
del
period of
antes del
peripartum.
nacimiento
Usually
hasta un
it's
par de
days
semanas después del
before
nacimiento.
the birth, up
Yo
to a
creo que
few
con
weeks
toda esta
after the birth. I think that
terminología
with
es
all this
importante
terminology, it's important
familiarizarse con ella y
to
dependiendo de
familiarize
cómo se está
yourself with
leyendo y
it,
cómo se
depending
está
on the
formulando.
literature that you
Los
are
números van a
reading
cambiar,
and
la
how it's
información
defined,
puede
the
cambiar,
numbers
así
and the
que
references and the
mantengan eso
information
presente.
might change. So just
Cuando
keep
hablamos
that
del
in mind.
posparto,
When we talk
usualmente
about postpartum,
hablamos médicamente de
usually
las
we
semanas,
talk
de las
medically
6
about the
semanas
weeks, the
luego
6
del
weeks
parto. Es
after the
básicamente
birth.
lo que el término médico posparto significa,
That's
son esas
usually
6
what the
semanas.
medical
Y
postpartum
cualquier
refers to,
persona
those
que
6
tenga
weeks.
un parto sabe
Any person
que
who has a
estamos
birth
embarazadas por 9 meses y
knows that
espero
we
eso
are
pues siga
pregnant
por toda
for
nuestra
9
vida,
months,
porque en qué momento
and that
termina, ¿verdad?
continues for our whole life,
Pero
because at what point does that
menos
end?
de 6
But it
semanas para
might
que el
take us more than
cuerpo,
6
y
weeks for
usualmente
the
toma más de 6
body
semanas que el cuerpo vuelva
to recover
a la normalidad o a lo que
to
éramos
its
antes
normal
o a lo
state,
que
or
pensamos
what it was
que nos
like
hace sentir
before, or
mejor.
what
Así
we
que
think makes
médicamente
us
hay
feel
una
better.
terminología en
So
el sentido
medically,
del
there's a
tiempo, pero
terminology in regards
realmente
to
cuando
the time
hablamos
span.
de salud
But
mental
usually when we
perinatal,
talk about
usualmente
mental
estamos hablando desde la concepción
prenatal
hasta un
mental
año
health, we're
después
talking
del
about
posparto.
since conception up
Así
to a
que en
year
cualquier
after
punto
postpartum.
después de que
So at any
cerca
point
del parto pueden haber
after
síntomas.
the child is born, there can be
También
symptoms.
hablamos y hay un término que
We
son los
also
primeros 1000
talk,
días.
there's in
Y
terms
esto
that
se
refer to the
trata
first 1,000 days.
de
And this refers
la
to
concepción hasta los 2 años después
conception
del
up to 2
nacimiento.
years after the
Y
birth.
sabemos que esto es una ventana de
We know
oportunidad
that
muy
this is a
grande
window, a
para los
great
seres
window of
humanos para que se
opportunity
puedan
for human
desarrollar,
beings
se
to be able
desarrolle el
to
cerebro,
develop. The
destrezas
brain
sociales,
develops during this
destrezas
time,
físicas. No
social
hay otro
skills,
momento
physical
en
skills.
nuestras vidas
There's not another
donde
time in
crecemos
our lives
tanto
where
como lo
we
hacemos durante
grow
este
at such a
periodo.
rate as we
Así
do
que si
during this
comparamos y
period. So if we
pensamos
compare and think
cuando
about
tenemos 10 años a 12 años o
from when
cuando
we
tenemos
have
20,
10 years
tenemos
to
21,
12 years or
cambia,
20
no
to
es tan
22, the
significativo,
change
pero
is
de
not as
0 a
significant. But from
2
0 years to 2
pasamos
years,
de simplemente
we
ser un
are going
feto a
from
ni
simply
siquiera
being
poder
barely a fetus or
controlar nuestra
barely able
cabeza
to
a
control our
caminar.
head to walking.
E incluso a veces
In
a sentir
fact,
empatía.
sometimes even
Hay niños
feeling
de,
empathy.
niños de
There are
2
children of 2
años
years
que tú dices, ellos bien,
who
desahogan porque sienten empatía.
they feel
Así
empathy.
que
So
eso ya es una destreza más
that is a
adelantada, es una
more
destreza
advanced
emocional.
skill.
Así que
There's
esos
an
primeros
emotional
1000
skill.
días,
And so
nuevamente
those first
sabemos más ahora
1,000
que
days,
antes
again, we know
cuán
more about it now than
importante
we did.
es
We know how important it
cuidar a esta
is and how
persona
important it is
que
to
nació
care
y
for this
usualmente depende
person
de
who
la
was
mamá
born
o
and
del
usually
cuidador o
depends on the
cuidadora
mother
principal.
or the
Y cuando
principal
hablamos
caretaker.
de salud mental, queremos
When
asegurarnos
we
de que
talk
esta persona
about mental
también
health, we want to make
está
sure that
recibiendo
this
cuidados
person is receiving care
mientras está atendiendo a el
while it
bebé
is
o la
tending
bebé.
to the baby or
Y
the
también es
child.
importante que ellos estén, que
And it's
desarrollen
also
bienestar
important
mental y
that they have a
físico,
mental
porque
well
el
being and that
impacto
they
que
are in a
tienen es
stable condition
significativo.
because the impact that they have is significant. A term that is used usually when we talk about postpartum is are many conditions that can happen during this period. We talk about the perinatal anxiety disorder, and we are moving away from an old terminology. We're talking about perinatal mental health and moving a bit away from that terminology of anxiety disorders because there's many implications involved in that. And so we are moving away from that terminology. So these are relevant terms that you should know if you're interested in learning more about the subject matter. What do we know? We know that perinatal mental disorders is one of the main complications of giving birth, more than gestational diabetes, more than hemorrhaging, or any other condition. This is a health problem, a public health problem, which is the perinatal mental health. Mental health. Many women can, 1 in 5 women can experience mental condition in pregnancy or postpartum. Often this is not reported because these are numbers that don't include the loss of a pregnancy or those that don't seek help or don't get treatment or treat themselves. The perinatal period refers to trans families as well. Thank you for that question. Fabiola, you can put your questions up. It doesn't matter the gender. Most of our literature is still dominated by cisgender couples, heterosexual couples. So that's why I try to bring the term gestational mothers, and we refer mostly to mothers because that is where the literature is at this point. But we have to make more studies to focus more on diversity and the trans families consisting of trans people. But that period impacts no matter what your gender identity is. What we do know is that the individuals that do identify with this condition, only 30% receive treatment for it. So very few ever reach treatment or adequate treatment for it. These are some of the numbers that we know. We know the implications of, let's say, I spoke of those 1,000 days, but there are bigger implications when we talk about an anxiety disorder, a perinatal anxiety disorder. When the person does not receive help for it, we've seen correlations in a lack of care in perinatal care. And obviously, if I'm suffering from this, I'm not going to have the energy to take my vitamins or go to the doctor. It's going to be more difficult to exist when I'm depressed. So that care, that preventive care that is necessary during the pregnancy is going to be interrupted if there is a mental health disorder which is not being treated. We've seen correlations in the postpartum period related to lactation. We know that it's harder for someone with a prenatal mental health disorder to continue providing lactation for more than 6 months, or even begin to provide lactation because it requires more effort from that person. We need more care during the birth, help the mother be comfortable, that stimulation that the child might need. None of this might be so effective if I don't feel okay or I'm not being treated properly. So the care of the child becomes more mechanic and not so much, the person is not so much present. So we see an impact in infancy, we see a raise in the mortality rates, in the maturation and weight when the mother or the caretaker is in poor health. We also have seen impact in short-term and long-term with an increase in lower weight, body index, lower cognitive development, lower immunization rates. And this can be seen reflected all the way up to adolescence, higher suicide rates, mental health problems during puberty. And we see it in those children that were raised by mothers or gestational people who were suffering from these mental health issues when they were raising them. So these are some of the implications in terms of the perinatal mental health that is not being treated. We have to be really careful when we talk about this. We don't want to have the person feel guilty for having a mental health disorder. They don't have any control over that, but the importance of preventive measures and early care is essential. That detection to be able to get that person treatment to be able to improve. I think that's where the message lies in all this, the importance of short and long-term care and the impact that it has, that perinatal mental health has when it is not treated properly.
I don't know how many of you are aware that in the United States, there's one of the highest perinatal mortality rates compared to other countries. This is the most recent data from 2024. And we have also rates from 2020, 2021. It has dropped a little bit. However, the reduction is not statistically significant. I believe that what is very important is to see the disparities between race and ethnicity, and how the Hispanics are in second place after Black non-Hispanics in terms of perinatal mortality rates. And obviously, this is very frightening. What we know about Latina mental health is that there is a depression prevalence in Hispanics of 37%, which is 12% higher than the general population, which means we are at more risk. Hispanic women have higher rates of depression than non-Hispanic women, but are less likely to be identified as depressed. And this might have to do of how we express depression, and it's not being detected. We are not getting the care when we need it. Something that we have seen with Hispanic women in the United States is that 32.4% of them present depressive symptoms, and 36.8 in Mexicans, which is very high. So Latinx women have more perinatal mental health disorders, and they must get the right treatment. And we'll talk more about it later. We do know that there's more risks for Latine. There's higher teen births, so there's more probability also of intimate partner violence. Also, there's twice the likelihood of receiving late care, beginning in the third trimester of pregnancy or no care. Latinas with private insurance have 22% more pregnancy complications than non Hispanics, and over 50% of Latina immigrants of reproductive age are uninsured. This mostly has to do with their habits, with their prenatal insurance, and not getting the prenatal care that they need. So there is many reasons why, and it's lost opportunities for us to identify mental health or perinatal mental health disorders. Recently, March of Dimes published a report talking about maternity health, and they say that any county without a hospital or birth centers offering obstetric care and without any obstetric providers. This is what's called maternity care deserts. And this is probably more prevalent in rural areas where there's Latina women or Hispanic women that are not receiving the prenatal care that they need. 96% of birthing age women in the United States live in an area with a shortage of maternal mental health professionals. And 70% of the US counties lack sufficient maternal mental health resources. So once we identify the disorder, then we need to specify what to do with this person, where to refer them, and where can they can get responsive care. This could also be part of the treatment barriers, which is a medical mistrust, especially by Hispanics and Afro Americans regarding prenatal care. There's two events that have been well documented. One of them was in 1930, the forced sterilization of Puerto Rican women, which was done to decrease poverty and population growth. And I urge you to watch the documentary called La Operación, the operation. And this was forced sterilization of Puerto Rican women. Also, at the end of the 1960s, 1970s, there was forced sterilization of Mexican women in California, and 10 of these women sued the state. So, as you can see, there is a background and a history that can create medical mistrust for seeking perinatal health and prenatal care. And we know that 60% of Hispanics reported being mistreated when they sought medical attention or medical care. And this still happens. So the mothers sometimes are screamed at or not or mistreated, abused by our health provider when they are having their babies. In a study from 2018, 7% reported that they felt that the medical staff did not communicate well with them, and 10% felt that medical staff did not support them during labor. So, this perception of abuse and mistreatment still is prevalent. Now, regarding the pregnancy, birthing, and the postnatal care, is a life journey. It's a life transition. There's changes in the body, hormonal changes, but this is not all that changes. It's just a part. And some of us are more sensitive to these changes, to the hormonal changes or body changes. But also our role and identity changes, who we were and who we are now. What does it mean to be a mother, specifically when you see it in the cultural perspective? Relationships also change, and this is very important. During times of crisis and transitions during this period, there are many, many expectations which are very cultural. And they tell you that, oh, this should be the best time of your life, and now you're going to be complete. And even though your relationship is not working out, hey, you're going to have a baby, and this will unite us. And we know this is not necessarily true. The reproductive journey that we talked about makes us wonder once we decide to have a baby, what is going to happen? What were my expectations? Should I be glowing? Should I be so joyful? But I feel nauseous. Also, what are the expectations during birth? And when we are talking to the Latine culture, what is the experience of having a baby in another country with another culture, not having your family around you? How does it feel to have your baby in another country? Now that I'm here, for whatever reasons, how do I feel about this baby compared to the other children that I already have? And what is the experience of becoming a mother? So we know that this is a very vulnerable time, a time of introspection for the pregnant woman, and once they have birth also. Another point is how it affects their partners. And what does it mean for me? What is my role as a mother? What I want to change, what I want to repeat. And it's really an ideal time for psychotherapy. And regardless of the fact that there is symptoms of not of the disorder, we should look into them. And this is the message I want to bring: the symptoms and disorders. I don't want to just say that this is a pathology. There's always going to be adjustments and differences, changes during this time of life that are not necessarily postpartum or perinatal or postnatal blues. It's more of the change that happens once we decide to have a baby and you experience the birth, etc. Now, having said that, let's talk about perinatal mental disorders. We usually just talk about postpartum depression, but this is not all. This is just part of many disorders that may happen and actually do happen during the perinatal and postpartum periods. There's anxiety and panic disorders, OCD, obsessive compulsive disorder, post traumatic stress disorder, bipolar disorder, postpartum psychosis, perinatal substance misuse or abuse, parental suicide, which is one of the main reasons for maternal mm, deaths during that period. And so we have to pay attention to it. And it gets complicated after the birth, which could also imply other losses for the parents in the community. The two conditions that have the asterisks are the ones that have an identifier in the DCM, just those two, which are depression and bipolar disorder. The DSM has to be updated with what's happening in literature and what we know nowadays.
¿Cuáles son algunos de los aspectos de riesgo?
Now let's
Primero,
talk about
sabemos
the risk
una historia de salud
factors.
mental personal o en
We
la
know
familia.
that having personal or
Eso puede
family
presentar un
history
riesgo.
of
Los
mental
estresores de vida o
disease
transiciones
is a
difíciles.
risk.
Sabemos
Also,
que
life
el
stressors
embarazo
or
y el
difficult
parto no pasan en un
transitions.
vacuum y hay otros
We
estresores
know
que suceden aun
that
cuando
the
estamos
birth or the pregnancy
embarazados.
does not
Puede
happen in a
morir nuestros
vacuum.
padres, podemos perder un trabajo,
There's
podemos perder el
other
hogar. Hay
things
otras
that
cosas que están
happen. Our parents
sucediendo
might
y
pass
piensen en COVID,
away.
como
We
COVID,
might lose a job or even COVID.
ese
Think
periodo
about
de
COVID and
tiempo
how
de estar
that
embarazado en
period
ese
of
tiempo
time
fue bien
affected us.
difícil para
And if
muchas
you were
familias, es muy
pregnant, that
complicado
was very
porque
complicated and
añadió
difficult for
a un
families
tiempo ya vulnerable.
because it added
La
more
falta de apoyo
vulnerability
familiar
to an
o social
already
saludable,
vulnerable time.
trauma previo o abuso
Also, a
previo
lack
durante
of
el
healthy
embarazo,
social or
complicaciones con el
family
parto
support,
o con
previous
la
trauma or
lactancia o el
abuse,
nacimiento,
including during
el temperamento del
pregnancy,
infante o un
complications
niño
with
con altas
delivery,
necesidades o
breastfeeding,
tener
or birth.
múltiples niños puede
Also, an
ser
infant
un
temperament or
detonante
high needs
para
or
algún
having
tipo de desorden mental.
more
De
than
una
one
historia de
child
infantilidad
could
o de
be a
pérdida perinatal,
stressor
sabemos
or a
que
trigger.
consistentemente la literatura nos está diciendo,
The
por
literature is
último, que la
always
deprivación
telling
del
us
sueño,
that
¿sabe?
sleep
Los estudios nos dicen que
deprivation
descanso en
is
sueño
very
es súper
critical.
importante para la salud
According to
durante esta
research,
etapa
we
y cómo
know
tenemos que
that
proteger
rest and sleep
ese
is
descanso.
crucial for this time, so we have to protect our
Veo
sleep.
aquí algunas cosas en el chat.
I'm looking at some comments in the chat.
Existe el suicidio en la
And
estadística sobre el suicidio
yes,
en
there
este
is
periodo.
certain
Y
statistics
usualmente,
about
¿se
suicide
está
during
refiriendo al
this
suicidio de
period.
pareja? Bueno, puede haber
And
estadísticas
is
en
it talking
eso, no las
about
tengo
the
aquí,
partner
pero cualquier
suicide?
otra cosa que
Perhaps.
ustedes
I don't
quieran,
have those
me pueden
facts
escribir
with me,
y
but
yo estaría
please
muy
do
contenta de
write to
compartirlo
me
con
if
ustedes.
you know
Así que
any other
hablemos de lo
information,
que
and I'll
es
be
normal
very glad
o común.
to share it with you.
Me gusta más
Now,
usar esa
let's
palabra.
talk about what
Así que
is
la privación del
normal or
sueño.
common. I don't love to
Sabemos
use
que es
this
un
word, but
ajuste
however,
típico
let's talk about
que
sleep
privarse del
deprivation.
sueño
We
va
know
a
that's a
impactar
typical
y comienza a
adjustment.
impactar en el tercer
Obviously, this
trimestre
will
del
impact you
embarazo.
in
No
the
dormimos
third
igual.
trimester
Igual que
of our
cuando ya tenemos un
pregnancy.
recién nacido,
We do
tampoco nadie
not
va a dormir lo
sleep
mismo.
as well.
Ellos
Also,
tienen
when we
su
have a
propio
newborn,
reloj
nobody's going to
y vamos
sleep
entonces
as they did before.
conociéndolo y
They
conociendo
have
su
their
ritmo y
own
conociendo su
biological
tiempo, sí,
clock,
pero toma
and we have
tiempo.
to learn to
Así que
know
esa
them
falta
and
de
know their
sueño,
rhythms. So this
lo
takes
que
a
es común
while.
es que los hace
So this
sentir
lack of sleep
cansados.
is
Y hay
normal.
algo que se
What is
llama
common
el
is that
sentimiento de
you feel
bebé,
tired.
es
And there's
como un
something
85%
called
de las personas
the
que
baby
pasan por esto
feeling,
tienen que ver
and
cómo
85% of the
el
people
cambio hormonal que llevan,
go
esto no es un
through this.
trastorno,
You have to
esto
see that
es
this is not a
parte normal
disorder,
del cambio
it's
hormonal y
part of
debe,
the
van a
hormonal
2 semanas
changes
luego
that
del
you are
nacimiento o del parto.
undergoing, and it's
Y pues
normal,
sí,
and it
los baby
lasts up
blues
to
te
2
hacen
weeks.
sentir
And obviously,
emocional,
the
pero no estás
baby blues will
deprimido.
make you
Es algo
feel
que surge
emotional,
de vez
but
en
you're not
cuando, ese
depressed. And this is
sentimiento de
something
que
that
tienen su
happens
recién
every
nacido en
once in
la
a while.
casa, que
The feeling
pasaste
that
por
you
el
have a
proceso del
newborn at
parto,
home, you
es
already delivered the
distinto a
baby,
cuando
and
tienes
this is
depresión
very
postparto o
different
ansiedad
from
postparto,
having
que esa falta de sueño
postpartum
te
blues
puede
or
hacer sentir
anxiety postpartum.
coraje.
The
Estamos
lack
hablando
of sleep could
de ese
make you
coraje de
feel
posparto,
very
esa intensidad
upset,
y la
very
duración es
angry.
diferente
So
de lo
the
que
time lapse
esperarías
is
en un
very
ajuste
different from what
típico.
you would
Cuando
expect
hablamos
in
de
a
crear
typical
lazos con el bebé,
adjustment.
eso debe suceder poco
When we
tiempo
talk about
después del
creating a
nacimiento. No
bond with
todo
the
el
baby, that should
mundo
happen
se
shortly
enamora de
after
su bebé
birth.
tan pronto
Not
lo ve.
everyone falls in love with their child
Usualmente
as
toma
soon as
algo
they
de tiempo,
see it.
pero
Sometimes it
cuando
takes a
tienen
little
esos
bit of
baby
time.
blues puede que eso no
But
pase
like say
inmediatamente,
when you get those
pero
baby blues, that might not happen
nuevamente
immediately. But
eso
again,
va
that
a empezar a
will
pasar en
start
los
to
próximos días, en las
happen
próximas
in the
semanas.
next few
Con la
days, next few
depresión o la
weeks.
ansiedad
With
postparto,
depression
esos
or
lazos con el
postpartum
bebé
anxiety,
puede que
the
nunca,
bonding with the
que no
baby
se
may
creen,
never
o puede
happen,
que
may never
tomen
be created,
un
or they
tiempo
might
muy
take
largo
way too
y
much
que tú
time.
pienses, yo pienso que
And
mi bebé no me
you might
quiere
think, I
o
think
no
my
lo
baby
reconozco
doesn't
como
love me,
mío.
or I don't recognize
Pueden
it
ser
as
algunas de
my
las frases que
child.
utilizan.
Those might be some of the phrases
Cuanto
you
a
hear
la
people
salud
say.
mente y el ajuste
When
cognitivo,
what comes to your mind and the cognitive adjustment, usually what's typical is that you'll feel forgetful or distracted. That's typical. And they call it mommy brain. When you have the baby blues, you might actually feel foggy or everything might look strange. When you have anxiety or depression postpartum, you're just full of scary thoughts, things that you think you shouldn't be thinking about this. It's important that we talk with the fathers and the mothers and ask them and try to normalize this feeling of having these thoughts that are actually terrifying. When it comes to feelings, when you're having a typical adjustment, usually you feel happy and you're hopeful. When you have the baby blues, you might feel weepy and emotional. And someone might say, and they might say to you, I'm crying, but I don't know why I'm crying because I am actually happy. I feel good with my baby. This is very exciting. That generalized feeling is positive, which is very different when you have anxiety or postpartum depression because they might not feel anything. Maybe they'll feel anesthetized, like they don't have any feelings. That they are asking themselves, should I even have had this baby? That they feel guilt or an extreme sense of sadness. And then after a few weeks, what we will observe in a typical adjustment is that they then enter into a routine that works for them, for us, for the child, for the family. With baby blues, you might start to feel better. This is not a diagnosis. It's not a disorder. This just has to do with a biological factor, and it shouldn't last more than 2 weeks. And with depression or postpartum depression, after a few weeks, the person starts to feel actually worse. The symptoms keep getting worse, and that is what we want to talk about. And that's the conversation that we want to open up with our clients. Depression between 26 and 32% is the prevalence of perinatal depression. We have the DSM-5, which has a specific criteria to diagnose depression or major depression in postpartum. There are some specifics that can be used, and we know that they should be presenting 5 or more of these symptoms during a 2-week period, and that it is consistent, that whether they be depressed, that they feel like they really can't feel joy over anything, there might be a significant change in their weight, sleep disturbances, agitation, fatigue, feelings of worthlessness, excessive guilt, and recurrent thoughts of death. And what do we know when it comes to the Latina community? We know that they are underrepresented in the literature. 37% of Latina parents have suffered some type of mental health disorder at some point. And as we look at this large range of 12 to 59 when it comes to depression in the perinatal period, when we look at these studies, usually they come from systematic analyses, but we see those differences depending on what has been used or the period or when it's being diagnosed. So the mental health disorders are common in migrant women versus the ones who are born in that country. Only 36% receive treatment compared with 52% of people not white, non-Latine. When we talk about perinatal anxiety, we're talking about a prevalence of 15 to 23%. And usually we include in this what we call the generalized anxiety disorder, but also the panic disorder. When we talk about generalized anxiety disorder, we talk about that feeling of anxiety, of nervousness that is present all the time. The questions of, is the baby eating enough? Understanding the signals that the baby is giving us. Feeling desperate when the baby cries. Why is it crying again? Is there something wrong? Is there something wrong with the baby? Is it me? Am I doing something wrong? This doesn't feel good. I shouldn't be feeling like this. So the mother could be feeling any of those things and present them in the consult and start to get information about sporadic abortions, the type of liquid genetic problems. They just start thinking about, what if this happens? What if the baby has this? And that's what you hear more often when it comes to the generalized anxiety disorder. When it comes to panic disorder, what we see is that fear of dying, fear of harming the baby, fear of losing control or going crazy. They might say that. Waking up in the middle of the night with the worries, not feeling well, and that constant fear of the fear. As we know, panic disorders usually arrive without any signals, and it's very scary. And it's very different from what the generalized anxiety disorder is, which is actually constant and the anxiety is always present. It's important to open up the conversation and talk about this. What are the concerns? What are you thinking about? What is the fear? Do you have intrusive thoughts that you are experiencing during this period that you find disturbing? When it comes to the perinatal obsessive compulsive disorder, 2 to 24% of people have it. And usually these are thoughts that have to do with concerns and images that have to do with harming the baby or something happening to the baby after the pregnancy. There can also be worrisome thoughts or images of sexual abuse to the minor. And we have to be very careful with this and remember that these are intrusive thoughts. And these parents might tell you how they're having these horrible thoughts, but it doesn't mean that they want to act on them, and they acknowledge that they're having thoughts that are concerning and they don't know where they're coming from. So it's very important to keep this in mind. We are working with people during the perinatal period with important concerns regarding the health and the security of the baby, of themselves, of the couple, and also fear of making the wrong choices. For example, when it comes to sleep, care, vaccination, medical treatment. So when it comes to perinatal period, the perinatal OCD can cause intrusive thoughts, which can cause stress and certain behaviors, which we have to help them with to be able to lower those levels of anxiety and concern. Sometimes it's simply a matter of the fact that they're avoiding. I've spoken to fathers and mothers who are dealing with these thoughts, and then they say, I don't want to bathe the baby. So usually someone else will accompany them while they do that because they're scared of harming that baby. Or they take all the knives out of the house because they're scared because of those constant images of something happening. When it comes to harming the baby. Of course, parents are not just going to open up and tell you their most dark thoughts in the first session. You have to normalize this conversation when it comes to intrusive thoughts and how they feel, and have the trust to to have them know that we're not going to call family services because we understand them and we assure them that thoughts are not actions, that thoughts are merely thoughts, and that if there's not an act behind that thought, and we can differentiate between what is a true danger and what is a part of these symptoms of what this anxiety disorder is about. We also have birth trauma. There's a prevalence of 4 to 45% of individuals who go through birth and have symptoms of trauma and who have a traumatic childbirth experience. And what this refers to is an experience of interactions or events related to the childbirth that cause overwhelming, distressing emotions and reactions, which then lead to negative impacts on the health and the well-being of the woman. Ask your patients, do you want to share the story of your birth? And usually they will share it with you. And usually it's something that they want to share and that they want to talk about. What are some perinatal traumatic events that could be present? And not necessarily it's exactly during the birth. Disrespect and abuse during childbirth. Also undergoing unnecessary and extensive interventions. Prematurity, having to leave the child in the intensive care unit. Some parents are not prepared for that and having to leave the hospital without their baby and having to go to the hospital to visit your baby, to see them. Anyone who has been in that unit knows that it can be a very stressful environment, all the beeps, all the noises. It can be very traumatic. Fetal death, stillbirth, that loss can also be the grief of that loss, but there can also be trauma related to that loss. To simply be sick during the whole pregnancy can be traumatic. People who go through pregnancies like that, where they say, I never want to be pregnant ever again. It was a really hard time of my life. It was very traumatic. I was throwing up the whole time, feeling sick for 9 months. And that can be very traumatic. A diagnosis of fetal anomaly can also be a traumatic event. Poor response to anesthesia. We've seen plenty of stories of nurses and people who have, of nurses telling us people who felt everything in the procedure because the anesthesia didn't work, to lack informed consent during labor, to feeling coerced, or having old trauma like sexual trauma. And during pregnancy, these can be activated during birth. And also the separation from the newborn can be traumatic.
Bipolar disorder also happens during this period. And as I said at the beginning of my presentation, it's one of the few known by the DSMR, and it's a perinatal specificator, and it could go from a prevalence of 2.6 to 20.1. There is a big gap in that prevalence, as you can see with the bipolar disorder. And we know that one of the symptoms is a mania. And for example, people feel like an imposter in postpartum depression, and that's what we mostly treat. And some women still feel that they have not been able to overcome the depression after 6 months. And this is when we have to go into their medical history. With bipolar 1, there is irritability, severe depression, They
cuando hay
talk
ayuda, estas son
very
personas que no
fast.
se pueden
People don't
ir a
sleep.
dormir o
Um,
dicen que no necesitan
they
ir a
don't want
dormir.
help with the
Se van a
baby.
limpiar la
These are
casa, hacer
people that say they
galletas y
don't
están
need
listos
to
para
sleep.
seguir
They
con
don't
algo
go to
más.
sleep. They start cleaning
Eso
the
es
house in the middle of the
lo que
night,
puede ser un
baking
episodio
cookies,
de
or
manía,
doing
pero
whatever
también
to
se
feel
puede
better.
complicar y
It could
deteriorarse con
also
el
be a
tiempo.
manic
Puede
episode
haber
that could get more complicated with the passing of
ilusiones,
time.
siguen con estas
There could be delusion,
alucinaciones, etcétera.
hallucinations, etc.
Así que con el bipolar 2
So
podemos ver que
with
la
bipolar 2,
manía
you
es
can see that
funcional,
the mania is functioning,
pero la
but
depresión vuelve.
it's also
Entonces, en qué
impaired.
punto deben ir entonces a
And
buscar
the
la ayuda
depression
para tener un diagnóstico
sometimes
y en el momento de dar
tells
este
us
diagnóstico hay
that
que ver el
they need
historial
help to get a
sobre el
diagnosis.
funcionamiento
And once
previo
they are
de un
diagnosed, we
bebé.
have to see
Sabemos que
their
el
history.
70% de las mujeres
We
con
know
trastorno
that
bipolar recaen
70% of
dentro de los
women
primeros
with
6 meses
bipolar disorders
del
relapsed
posparto.
within the first 6 months
Y
postpartum.
otro asunto importante aquí son los
And another
medicamentos
very important
y los
point here is
proveedores que se sienten
medication.
cómodos
And the
recetando
providers that
durante el
feel
embarazo
comfortable
o no.
prescribing
Y
medications
muchas
during the
mujeres se quedan
pregnancy
sin
or not.
tratamiento, sin
There's many
medicamentos,
women that
sin
are not
apoyo, sin el apoyo
receiving
que
their
pueda que necesiten
medication
en este
and the
periodo,
support that
especialmente
they
cuando hay un
need during
historial de
this
trastorno
period of time,
bipolar, el hacer un plan y
specifically when
mantenerse en el plan
there's
y
a
tener un buen
history
tratamiento
of
y un grupo de
bipolar
tratamiento es muy importante en este periodo.
disorder, and they need treatment, which is very important during this
La
period.
psicosis, como sabemos, es uno de
Now,
los
let's
casos
talk
más
about
severos
psychosis.
de salud mental
Psychosis, as
que
we
pueden
well know,
suceder
is one
durante
of
este
the most
periodo.
severe
Es
mental
uno
health
que
disorders
es
that could happen
menos
during
frecuente,
this period, and
pero es una
it's not
emergencia
as
médica cuando
frequent.
sucede.
However,
De
it's a
1 a
medical
2% de
emergency
las
when it
mujeres
happens.
pueden tener
1
un
to
episodio
2%
psicótico
of women could
luego
have a
de dar a
psychotic
luz. También
episode
puede
after delivery,
suceder durante el
and it
embarazo.
could also happen
Esos
during their
porcentajes aumentan
pregnancy.
cuando hay un
These
historial de
percentages
desorden
go
bipolar o
up
un
when there
historial de
is a
esquizofrenia.
bipolar history or
Cuando hay
schizophrenia.
una historia personal de
Also,
psicosis
if there's
posparto,
personal
de casos que lo hayan
history
tenido
of
en un parto
postpartum
anterior,
psychosis in a previous pregnancy, it's
aumenta el
more
riesgo por
prevalent and it
50% en
increases
partos
the,
posteriores.
the risk in 50%.
43.5% son eventos aislados de
43.5%
psicosis
are
postparto. Eso es buena
isolated
noticia porque no
postpartum
vuelve a suceder,
psychosis.
pero el
And these are good news because it means that it
56.7%
won't happen
experimenta
again.
condiciones que los llevan
However,
toda la vida, de condiciones
56.7%
psiquiátricas.
experience lifelong
Estos
psychiatric
usualmente se
condition.
manifiesta 2 semanas después de dar a
And
luz.
the
O sea que
onset is
rápidamente luego de dar a
usually
luz vamos a
2
ver
weeks
cambios en
after
síntomas y
birth.
en
So
comportamientos.
we will see
Estas son algunas de las
immediately
preguntas que
after
queremos
birth
hacer
changes in
a nuestras
behavior.
madres. ¿Tuvo
And
alguien,
these are the
han tenido una
questions that we should
un
ask the
historial
moms.
de enfermedad bipolar o psicosis?
Do they know
¿Sienten que
if
tienen que
anybody
esconder lo que
in their
están
family
pensando o
had
sintiendo para finalizar?
problems
Pero
of
solamente las personas
psychosis?
van a
Do
saber a
you
quién
feel like you
decirle
have
o no
to
decirle
hide
sobre lo que
what
están
you feel
sintiendo o los
from
síntomas que
others?
están experimentando.
Normally, people will
¿Te
talk
sientes como un
about their
extraño a ti
symptoms.
mismo? ¿Te sientes
Also, another
desconectada
question
de
is, do
tus
you
seres
feel
amados
like
o
a
de tus
stranger to
amistades?
yourself?
Algunos de los
Do
síntomas que
you feel
pueden pasar
disconnected from
durante la
loved
psicosis
ones and
perinatal son
friends? Some of the
creencias
symptoms during
extrañas. Los
perinatal
síntomas pueden
psychosis
ir
are
y venir, no
strange
siempre están
beliefs.
presentes, o sea que tenemos que estar
Symptoms could
bien conscientes
wax
de
and
nuestro
wane, so
intake
we
y
can
nuestro
also and should
preguntarse las
always
alucinaciones,
be
hiperactividad,
aware
paranoia,
of
sospecha, cambios
hallucinations,
rápidos de ánimo,
hyperactivity,
dificultad comunicándose,
paranoia,
tiempos. Tal vez sintiendo
suspiciousness,
pensamientos
rapid
de que el bebé
mood
está
swings,
poseído o que el bebé
difficulty communicating,
estaría mejor
or
sin
even
ella. Es
feeling
también
like
muy
a baby
importante
is
incluir a las
possessed or
parejas
is
o
not
las
with them.
personas que están viviendo con esta persona,
Obviously, it is
traerlos para que
important
tengan un
to
sentido de
involve
lo
the
que están
partners, bring
viendo
them
y que están
into the
viendo y que están
conversation so
observando.
that they can have a sense of
En
what's
cuanto
happening and
a la
observe
salud
the
mental
changes that are
paternal,
happening.
sabemos que
Now,
el
in
posparto
terms of
es un
postpartum
tema que también afecta a los
mental
padres.
health,
Los papás
this is an
experimentan
issue
duelos
that
sobre
also
sus
affects the
viejas
parents, the
vidas e
fathers, that
identidad,
is.
que 1 en 10
The
padres
dads
puede experimentar
experience
depresión
grief
posparto
over
y
their
uno en
old
cinco de
life
sus
and
parejas pueden
identity.
experimentar depresión
Many
posparto o
of the
ansiedad
dads can
posparto.
experience postpartum blues or anxiety. 18% of the dads develop clinically significant anxiety disorder. So we need to be aware and pay attention to the dads, invite them to participate, to tell their stories, how they feel. Recently, there was a publication of two articles on vicarious trauma for dads if they were present during the delivery and they don't have the opportunity to process their story and their experience. Now, how do the dads manifest their symptoms? Well, it depends on the culture. In the Latina culture and because of the machismo, they don't really express what they feel. They might isolate themselves, not be present, spend more time with their friends. They might feel burdened, also sleep deprived. They could feel more anger, irritability. They could cry or be sad. They could feel jealous about being left out. Hey, now I lost my partner. She's always with the baby. She doesn't even look at me. Or the cultural social expectation to man up and just leave your feelings behind and just take care of business. And once again, comply with their gender roles of being the provider. Maybe perhaps they didn't have good role models and they repeat what they saw of not being available, checking out, not expressing their feelings or being available. Other experience that impact the perinatal mental health is the changes in whatever they're doing. They're taking care of the children all the time, or maybe there was some sexual abuse, or the DMER, the dysphoric milk ejection reflection, and that you can find more information about this. And normally, it's seen in people who are breastfeeding, and this is a feeling of extreme anxiety or even anger when your milk goes down, and it creates a lot of anxiety, and people state that they don't want to breastfeed anymore, or they feel like I'm not doing what I should do. And I wanted to mention this because it's quite a new phenomenon, Dietmar. Just be aware that it does exist. Once again, eating disorder could be a trigger, and just being aware of their history is very important. Now let's talk how to help the women or families when they don't know what's happening or what's wrong. How can we reduce stigma and normalize the new mother's need for support? Well, our role is to screen, educate, and act. Something that is very important is that we should have cultural humility and also be curious about the person who's sitting in front of us. We talk about Latine, but we know that the experiences and the people are experts on their own experiences, on what they're undergoing and what they feel. So we have to collaborate with them. And here I want to show you some questions that could be useful to ask. For example, what would I need to know about you so I can help you or support you? What matters most to you in this experience? Help me understand your explanation of mental illness and symptoms. Are there aspects of your background or identity that make a difference to the difficulty you're experiencing? Is it because of your social, cultural background? How do you see it? And always be willing to learn. Now, what are some of the norms related the perinatal period in the Latina community? We talk about the cuarentena or the 40 days after the delivery, where the woman is taken care of. There's some cultural rituals that we have. For example, the mother or other maternal figures in our life come in to take care of us. And this is an ancestral ritual that has been lost in time. And because we are moving and don't have our extended family together, however, some of us still conserve this tradition. And we have the ideas also of Marianismo, which are based on the Virgin Mary, opposite to machismo. And they see the mother identity and the sense of duty. And what does it mean? How do you understand it? I am supposed to think that this is the best time of my life. However, I feel like anxious, I'm depressed. And who do I tell this? Who do I share it with? Also, the machismo, the role of the father that we mentioned before, and what does it mean for the mother? What does it mean to be a father? Perhaps I have never had a man role model, sorry. I've never seen a man during delivery. Um, as a man, I don't know what to do with an infant. This is the mom's role. Maybe they want to help, but they don't know how. Or perhaps they are not even given the opportunity to do it. Also, the mothering, the experience of loss, quote unquote, that you feel you're in a different land. And how does it feel when you do not have your family with you? Also, another norm in the Latina community is the multi generational household. During a postpartum period, perhaps you have a lot of people with you taking care of you and nurturing you, or the opposite, you're getting ill advice. Everybody's trying to tell you what to do, and the mothers usually assume the control, and this could perhaps affect the mother and how she bonds with her baby and her self assurance. Another point is religion, spirituality, and family values. Now, in terms of the distress and how we feel, perhaps we talk about nerves, being a nervous person. Maybe we talk about panic attacks or nerve attacks, quote unquote, which are symptoms that include, as I said, panic attacks or disassociative features. Perhaps we see it as fear, as something that scared us during the delivery or during the pregnancy, and you were feeling this way. And perhaps it has to do with the postpartum symptoms. So it is very important to learn these concepts and how it is perceived and why it's happened. It's important to know why for the Latine they experience their emotional experiences. And also another thing is that we feel better speaking in Spanish. And when I'm talking about language, not just translating, but understanding the content of what it means. And different words have different contexts in Spanish. The perinatal period is ideal to do evaluations. A person that has a pregnancy that's not complicated has an average of 25 interactions with providers, including doulas, childbirth educators, lactation consultants, home visitors, people that can evaluate symptoms and refer them to treatment.
Perinatal period also offers an incredible opportunity to impact the generations. What we know is that there are very various of the recommendations. The American College of Obstetricians and Gynecologists has some recommendations, just like the American Academy of Pediatrics, the U.S. Preventative Service Task Force, and what we know that is ideal is to have evaluations during the first prenatal visit and at least once in the second trimester and third trimester and 6 weeks after the postpartum visit, and then repeated screening at 6 and 12 months or 3, 9, and 12 months throughout the pediatric visits. And during that postpartum year to do evaluations, keep talking to them about mental health because things can change, and we know that the depressive symptoms can escalate during the 3rd or 6th month of postpartum. So it's not just about those initial weeks of postpartum. Ideally, we provide a private space for this. These are some of the screening tools for evaluation. The Edinburgh Postnatal Depression Screen is one of the most commonly used ones. It comes in more than 60 languages and it's free. It's available in Spanish. It's 10 self-administered questions, which are very easy to answer and complete. These are formal tools, but we also have the ability to be present. What do we see? What do we hear? What are you hearing them say? What sense are you getting from this mother, especially if you've been working with this person during pregnancy and now in postpartum? What is different? What feels strange? So the evaluations are very good, but your clinical appreciation is very important too. And open up the conversation. Ask, how do you feel? Educate our client and their family. If the family is present, it's important to include them and educate them about what is this? What does it look like? They're not just being changos, like we say in Puerto Rico. This is real. They're not making it up. It requires treatment. And with treatment, they can get well. Avoid judging. Motivate small actions that will help support them, support the mother and the baby. Acknowledge the resources in the community. Always be aware of the words being used. And instead of saying, oh, your mom, it's normal, talk about this is an event that is changing your life and that maybe it is normal and common to feel like this, and with this treatment, you will feel better. You don't have to suffer alone. And this happens a lot. And it's courageous to get help. Break that stigma of seeking help for mental health. Talk to your client from a space of curiosity. Get to know the communities, get to know the dialects, get to know the resources available. Make space to talk about the immigration stories. If there is any story of your own, talk about that and how it's impacted your pregnancy. And also reflect upon the fact that your clients might have experience a very different experience of motherhood or fatherhood, very different from our own. Ask them, what is maternity within your family expectations? What maternity skills do they want to repeat or replace? What was the role of their mother, or what is the role of their partner or their family in this process? What role does religion play during this period of their life? How do they understand maternal mental health? Where do they go for emotional support? Maybe it's not going to a counselor. Maybe they have support elsewhere. And also ask them, tell me about your experience of being pregnant in another country. Always think about doing a person-centered and trauma-informed approach. Remember that healing takes time and connection, and you have to seek out the strength that we already have. And be practical. Be practical in your recommendations. Again, postpartum is difficult for the majority of us. So we want to motivate the management of stress and coping skills. We want to motivate taking care of our physical health. You just went through a birth that's brutal on the body. How are you taking care of yourself? How are you protecting your sleep hygiene? What do you have to do to protect that sleep and that rest? Who can be there for you to help you rest better and longer? What nutrition are you providing to yourself? Which is also related to mental health. What are you eating? Who's feeding you? What things are available to you to eat? Something that you have to cook a huge meal every time. Exercise, movement, social support, and reinforce the strengths of that person as well. Here are some common themes that we hear in the conversations when we're talking about with perinatal people. Ask them about their birth story. That's going to ask about the parental role in the transition, the grief and loss, because there's not a literal loss, but maybe there's other losses that we experiment. Communication with their partner, communication with their family, communication with their friends. That is a very common theme. And also the feeding alternatives and bonding alternatives. Am I doing this okay? What's the best way to do it or not? Those are also important. These are some of the resources that are available. I want to acknowledge Postpartum Support International for all the training and all the information that I have available in English as well as in Spanish. And for starting this conversation, this is a tool that you can have available. You can download it for free. These are the support groups that they have in English and in Spanish. They are available. You can go to their page and look up the details. But you can also see that there are various groups for all types of perinatal experiences. And if you are working with a parent who is struggling, know that there is a free helpline in English and Spanish. There are people that can provide prescription if you're working with them, and they can also receive a consult from perinatal psychiatry for your patient if you are not sure about some type of medication during the birth or the lactation period. There's a directory, and it's important to acknowledge what are your resources. The National Maternal Mental Health Hotline is in English and in Spanish and available 24/7. You should keep it on hand and your clients should have them. Before we start with the questions, I want to invite you to reflect about some of these questions and take them with you. What is the protocol of your institutions? Do you have that protocol for screening all new parents? How many times are you screening? Are you doing follow-up if there's a positive score in screening? And not only what are we doing, but what are we going to do with that? How are we following up on that? Is your space welcoming to diversity? We have diversity. We have people that might seem to be Hispanic or people who are not. And we have to make them feel welcome in that space. Do you have an established referral system? Who do you know? Do you know the doulas in your community? Do you know the therapists? This is part of knowing your team and knowing your resources, because more people we have available, more support this mother or this gestational person will have and receive. Do you have flyers or material to handouts regarding the symptoms of perinatal mental health? You know that you can call PSI and ask an expert. Do you feel comfortable referring someone to a support group? Do you know where they are? Do you want to start a support group? We need support groups. And last but not least, it can be intense seeing a parent who is suffering. And how are you managing your feelings and your reactions? Because self-care is vital. When we are working with this population and the work we are doing in the mental health field. And now I want to open it up to questions if there are any. But before that, I want to remind you that when you pay attention to the beginning of the story, you can change the rest of the story. And I think that's very important to keep in mind when we are talking with these generations and this perinatal population, because it creates an impact that lasts for a very long time. So allow me to hear from you. Thank you, Doctora Marianela Rodriguez. This was a presentation, a wonderful presentation. There's many things that I can think about, stories that I've heard about validation factor, interpersonal validation factors, collaborations with clients, and organizational changes that we probably need to do and we should implement when we collaborate with our clients, and we should keep in mind. To everyone, thank you for being here today. If you have questions for Doctora Rodriguez, you can use the Q&A tab in your Zoom, and this way we can then give her your questions. This is where I turn into an influencer. You can follow us on all our platforms in social media. And also, in the next slide, please fill out the evaluation before we go to questions, or while we are doing the Q&A, you can use that QR code, or I will share with you a link through the chat so that you can fill it out. We'll be here for the time we have left to hear your questions. I think I saw some questions in the chat while the presentation was happening. Maybe we can start with those. I think one of them, I don't know if this was when you were talking about postpartum depression or the intrusive thoughts related to the clients with this. It says, are they only thoughts of doing harm to the baby or also harm to the partner? That is an excellent question. Yes, there can be intrusive thoughts about harming the partner and, in fact, even themselves. But usually what we hear the most and the most prevalent theme is that it's related to the baby. During pregnancy, there might be something related to foreign bodies, infections, sickness, disease, or something that happens to them. But usually, what distinguishes this OCD during this perinatal period is that those thoughts, those intrusive thoughts, tend to have to do with the baby. But yes, the situation and the relationship with the partner are very important. And they are very much impacted as well. Okay, we have another question from Ana Torres. From peripartum to when the depression starts, is that immediately in the postpartum or at any time during the first year? It's at any time during the first period. The DSM does have a limit, but we know that the literature, again, we need to update this. The literature shows us that it can be at any time during that first year in which the symptoms might present themselves and continue worsening in the third and fourth month of postpartum. So that early onset in the first few weeks of postpartum, it doesn't really make sense. And it doesn't reflect what we are seeing and hearing. We have a question from Isabel Reina. How would you talk with a client? How would you work with a client if you realize of the postpartum depression symptoms? Thank you for the question. I think that we should start speaking about perinatal health from the beginning. From the moment the person starts thinking about having children, we should start talking with this person about mental health. And if at any point we start observing something, then maybe that's where those evaluation tools come in, because it's an objective way of opening up this communication. And when you use an evaluation tool, the person self-identifies and says, oh yes, this is it. Or, like I mentioned, that discussion tool of PSI, where that really what it does is open up the conversation. of how some people might feel stressed, some might have these intrusive thoughts, some might feel that they're not creating bonds with the baby. So how do we open up that conversation without having to say, you look depressed? That's how we can start that conversation. Thank you. We have another question from Dolores Gonzalez. Most of the time, these mental health diagnoses are common, especially in teenage moms. Yes, my understanding is yes. In fact, they are high risk. Adolescent mothers are high risk of having mental health disorders in the perinatal period. Lorena Garcia, can we get information about how we can start a support group in a reproductive mental health program? Yes. I don't think we have the time now to enter into that in detail, but if you want, I can give you some resources. One of the things that I think is very important is to receive training like this webinar, certifications. There are longer trainings where you can get support and open up a group for like peer support group or group therapy if you're a mental health provider that are geared specifically to the perinatal period. So I invite you to receive more training. And I think that you would have a better understanding then of what you need and what you should do to provide that support. Thank you. I think that's all the questions. And later we can talk more about opening up the conversation with parents. What is a way in which parents can talk about with their children about these struggles during the perinatal period? That's a very interesting question. I think you have to base it first on the age of the child and their development phase. What are the conditions with which the parents are dealing with? And I think that we work with many families that have gone through a perinatal loss, and for them it's very important to share with their children that there was a baby, that there was a loss, and how do they explain that to them? There are books for that, and how to bring that loss to the reproductive history of that family. I think it's very important, but it depends of the age and in what development phase they are, and if they can understand, and what do you want to share? Do you want to share that you had issues with depression and were able to seek help? Or, it depends of what they should share and how to share it. And also understand that this has nothing to do with them, that it's not their fault. And that mental health is something that can happen to any of us and does not discriminate. The importance of identifying it and seeking out help to feel better. Well, thank you so much. This has been a incredible presentation and conversation. We have been able to talk with our audience. We want to thank everyone who joined us and is working with the Latina communities. This is important to reach equity in health, and we hope that today's presentation can be integrated into the services that you are providing. So thank you, everyone, for being here with us today. I will share with you the link to the evaluation once again. We'd love to receive your feedback. And goodbye, Dr. Rodriguez, and everyone. Thank you for being here. Thank you.